done. My name is Telmo, and my number is P1097321. I'm talking about the principle and purpose of research, which is gathering as much data and information possible with a rational method in order to get knowledge to improve the subject of the research. In this specific case that we have been studying, the example is a significant number of palliative care patients have difficulty communicating their needs, which may be a result of dysphagia, cognitive impairment, or extreme frailty. The aim of this project was to support hospice staff to provide person centered care and improve symptom management for these patients. Um, Let me see how this computer works. All right, yeah. Yes, yeah. Why, uh, why is research, yes. Why is research carried out in health or social care? Well, it is to check how effective our services are, how effective drugs are, and find the best treatments. Share knowledge and understanding about different conditions, provide the best advice and treatment for people. In the article example, the project team comprised a multidisciplinary group of hospice staff and already established a group interested in meeting the needs of people experiencing cognitive impairment. The project was developed in two phases. Phase one aimed to support nursing staff to develop a general level of skills to understand patients with difficulty expressing their needs and to avoid or relieve unwarranted distress. Phase two was looking to promote multidisciplinary staff with specific skills in supportive and augmentative communication techniques and the use of a behavioral assessment tool. Um, why evidence-based practice is important when making decisions in health and social care? I really can't read this slide from here because the text is huge and the letters are too small, so I'm gonna skip this one and carry on. How does research support us to develop, improve, and identify gaps in practice or provision? Knowledge gaining, improve practice, learn new ways of working, change bad practices. In the article example, the booklet designed a clearly improved knowledge, created a new way of working, and improved practice. Is the research carried out cost effective? And does it promote the health and well-being of the service users? No doubt about it. This is value for money. It increases the skills of the staff and promotes the health and well-being of the service users. According to the article, to improve the skills of healthcare professionals in caring for palliative care patients who have difficulty expressing their needs, and to provide resources and tools to aid communication symptom assessment and promote personhood. The booklet is again an evident example of that of those tools. Who's involved in carrying out research? Well, it's the government, health authorities, staff at the hospice. The article is an example of public health done by using statistical and epidemical data carried out in the NHS hospitals, surgeries, dentists, care homes, or residential care services with patients and service users. And social care research, which investigates a number of social issues and reports the findings. The the methods used are questionnaires, focus groups, and interviews, aims to find out knowledge that could lead to changes to health treatments, policies, or care practices. The background was the St. Gemma's Hospice, who provides an integrated palliative care service comprising an inpatient unit with 32 beds, a day unit, and community team. Patients with a life-limiting illness are referred to the service for the purpose of symptom management, psychological support, and/or end-of-life care. In line with the original vision put forward by Dame Cicely Saunders, founder of the modern hospice movement, St. Gemma's Hospital looks to integrate research and education with clinical practice. This is done through a dedicated academic unit of palliative care, which has affiliations with the local university. It supports research, education, and training internationally, nationally, and locally, and aims to offer a structured and supportive learning environment for the staff. Their roles and responsibilities is the government is responsible to gather a statistical data based on evidence from CCGs and local authorities to identify gaps in care and provision. This data is used to plan the future in order to improve the health outcome of the population. Plans and allocates resources accordingly based on need. The health authorities are, oh dear, the health authorities, I lost it. No. I totally lost my presentation.
Don't worry, take your time.
Totally lost. Oh, here we are. Sorry guys, yeah, here we go again. I was talking about who the government authorities and the health authorities. The health authorities are defined by legislation and are responsible to provide health in their regions. Sorry guys, I need to return back here and find what it is.
How deep?
I need to. Just look out, I'm totally lost.